Hang on.
All right. Hi, everyone. We're just going to give it a couple minutes for everyone to file in, and then we will get started with today's panel discussion.
Shannon's saying she can't see the interpreter. Oh.
Is that better? Sorry, I forgot to put it in gallery view.
She lost the interpreter again.
Okay.
Oh.
It looks like the interpreter's might not be on.
No, it's me. My camera's
it's you.
on.
Your camera's on. Okay.
We take turns.
Okay.
Yeah.
Is it okay now?
No, she's not responding yet.
Okay.
Oh, when the interpreter speaks, I can see the interpreter. Shannon, did you hit gallery view at the top right corner? Okay, I can see all of us now.
Okay. Sorry about that. Yeah, I know we're live, but we're just having some technical difficulties. Okay, it looks as though everyone has pretty much filed in, so we're gonna go ahead and get started. Hi everyone, my name is Katie Shelley, and I am a disability rights advocate with the Ability Center. And I would like to welcome you to the second of 4 sessions that are part of our 4th annual ADA seminar. And this year's seminar theme is disability issues and COVID-19. The ADA seminar came about as a way to connect ADA coordinators in our area to us and to help educate them on what is required under the Americans with Disabilities Act. If you would like to be part of our ADA coordinator network and are not already, don't hesitate to reach out to me at kshelley@abilitycenter.org, and I will make sure you are added to our listserv. I send out a blog post on ADA-related themes every couple of months, and I keep ADA coordinators up to date on trainings provided. I'm also more than happy to meet one-on-one with local jurisdictions in order to provide them with technical assistance on the ADA. We just have some housekeeping items before we get started. Just as a reminder, we have 2 more webinars coming up as part of our ADA seminar series, and all of them start at 10 a.m. This coming Tuesday, October 13th, we have speaker Valerie Novak, who will be discussing emergency preparedness and disability during the COVID-19 pandemic. And lastly, on October 15th, we will have a panel on healthcare equity during COVID-19, where representatives from the Hospital Council of Northwest Ohio will discuss their collaboration with the Ability Center on the revision of guidelines for resource allocation for people with disabilities in response to the COVID-19 pandemic. Also, a reminder, if you registered for and attend all 4 sessions as part of the ADA seminar, you will be entered to win a grab bag with Ability Center swag, and that includes a Toledo is for everyone t-shirt. So for today, we have a panel on access during COVID-19 pandemic, and that features local disability advocates. We are doing this panel due to the fact that we have seen both greater access as well as access issues come about as a result of the COVID-19 pandemic. And we wanted to bring together these local disability advocates in order to discuss how the COVID-19 pandemic has impacted access either for them or for the communities they serve. Our moderator for today's panel is our Advocacy Resource Associate here at the Ability Center, Angie Goodnight. Angie owned and operated Angie's Angels, which was a home health care agency. For years, she thoroughly enjoyed working closely with people with disabilities, and that was her only connection with disabilities until 1998, when she contracted pancreatitis during pregnancy and lapsed into a coma for 14 days. When Angie woke, she found that she had a new baby daughter and that she had lost her vision. Over the next year, Angie had to relearn how to do everything. But now, as the Advocacy Resource Associate at the Ability Center, she assists many people on a daily basis with self-advocacy, as well as obtaining access to information and resources. Angie loves to educate people with disabilities about the services that are available at the Ability Center and in the community. She is also the chair of the Toledo-Lucas County Commission on Disabilities. Please help me welcome Angie Goodnight.
Thank you, Katie. Good morning, everybody. I'm excited to be a part of this panel this morning. So what we're first going to do is have each of our panelists introduce themselves and give a little introduction. We'll go first with Sara.
Good morning, everyone. My name is Sara Soper, and I am the Office of Accessibility Services Coordinator and the Academic Coaching Coordinator at Lourdes University. And I have worked in the disability field for a little longer than I'd like to admit to. And I also happen to be blind. And I think that has really assisted me with my work with supporting young people with disabilities to transition from high school to college, and also to obtain the academic and residential accommodations they need to be successful here at Lourdes.
Thank you, Sara. And next we have Dani. Dani, are you on?
I'm on. Sorry, I was muted. I didn't know there was a thing still in this kind of a big group. So I'm Dani from the Site Center of Northwest Ohio, and I'm a program director here. We have a really small staff, so program director at the Site Center means I do lots of great things. And I think that advocating is probably one of my very favorite ways to engage with people and empower people to have access to all of the things everyone has access to. Really glad to be a part of this panel. And like Sara, I think when you do these panels, you realize, wow, I've been doing this for 25 years. It's a really long time. I'm glad to be with you this morning.
Thank you, Dani. And next up we have Shannon.
Yes. Hello. I am Shannon Seger. I myself am deaf. I have an interpreter here speaking for me, so that's really nice. Thank you for that. And also, I'm the director for the Deaf Services Center of Northwest Ohio. My passion is also in advocacy. That means I want to get equal access for everyone, for both people who can hear and see everyone have the same rights equally for those who cannot, and make sure it's an effective access for everyone. So that's my passion. The Deaf Services Center provides a variety of different services related to anyone with any kind of hearing loss. Anywhere from profoundly deaf to any kind of loss of hearing. We provide peer support, information resources, employment support services, language support services, you name it, we can provide something like that. We are out in the community advocating, spreading awareness and education. So thank you for having me here today.
Thank you, Shannon. And next we have Tenesha.
Hello, my name is Tenesha Ulrich. I'm the president of United Spinal Association Northwest Ohio chapter. I consider myself an advocate first. I started to advocate for myself as someone with a spinal cord injury. I'm a para and my injury is at T12. But through our group at United Spinal, we get out and advocate and educate. I've been to an event called Roll on Capitol Hill through United Spinal, where we've gone and advocated for disability rights in Washington. And we do advocacy locally where we talk to PT and OT students about how to work with spinal cord injury patients in a clinical setting. I'm also part of a wheelchair tennis group, which is local to the Toledo area. And it's a great way for people to get out and enjoy being active. So thank you very much for having me today.
Thank you. And last but not least, we have Kelly.
Hello, thank you for having me. My name is Kelly Elton, and I'm the Vice Chair of the Autism Provider Network of Northwest Ohio. We are facilitated by Avenues for Autism. We're a professional networking group that comes together to collaborate and help support each other's missions in supporting individuals with autism in our community. Thank you.
Thank you. So as Katie had mentioned, I am blind. I use a screen reader on my computer. So bear with me listening to my computer and speaking at the same time. Occasionally has its difficulties. So with that being said, we will start with our first question, which it's for Sara and Dani. You each will have 2 minutes. Has accessibility and technology, such as Zoom or online shopping, been an issue during the pandemic? If so, how? Sara?
I think that's a wonderful question. And in my experience and in the experience of a lot of my friends who have disabilities, and we'll talk about blindness in particular, yes, online shopping has been a bit challenging during the pandemic. So there are some certain challenges that may not be for all different companies, but if the web accessibility isn't up to date, a lot of people will try to go online to shop and maybe make like a grocery order and the cart doesn't work. There's no text to tell the person where to put things in their cart, or maybe that works, but then you have to schedule a time to come and pick up your order and the buttons are not labeled, so you can't even use the calendar to schedule, which is a little stressful for people. And I think another concern is knowing what you're buying. If you're buying clothes, or I know I did an embarrassing amount of online shopping during the pandemic when I was working from home for 5 months, and we really couldn't get out much. And luckily for me, I have a pretty fantastic support system of people. So if I were going to purchase, say, some clothing, I could have someone with me telling me like, oh, you'd either like that or no, don't even think about it. That would look terrible on you. Of course, they were sweeter than that, but that's also a challenge though for a lot of people who don't have a large network of people. Yeah, there's customer service. However, customer service doesn't necessarily know the person or their likes, and so that can be quite challenging. But I think especially during this pandemic, a lot of people with disabilities were kind of cut off from their support systems or unable to access paratransit. And so they often struggled with getting the items they needed in a timely manner, because if the websites weren't accessible, they couldn't really have access to the items they need. So that definitely was a huge challenge for me and also for other people in the disability community.
Thank you. Dani?
I totally agree with what Sara said. Obviously, everything came to a screeching halt and people had to find new ways to do things. And it did bring to light a lot of issues. Do people have equipment? Is their equipment current enough to speak with the software from the places that they might be trying to access information? If not, how are they getting information? How are they getting access to all of the information that was presented online? And it seemed like in the beginning of the COVID pandemic, information was changing so quickly. And if you didn't have technology, it was really challenging to interface with other people and find out who in your community had a good resolution and who had solved a problem already that you were facing, and how could you follow what they did. You know, I think that people were isolated and we lost our sense of community. And if you didn't have technology, I think it was compounded. It was much, much more significant. It drew to light the need for funding for equipment and funding for training, access to people who are experts in training and accessibility, not just how to use the software, but how to train a person who might have a disability who learns in a unique way. What backups do people have if their technology fails and we have to go old school? How are we really reaching out to people that we know are in our community that usually rely on certain supports that were taken away? Connection to family, you know, this is a great way to reach the community, but you know, some people were doing big Zoom meetings with their family. And I think in the beginning, it took some learning curves, even just to understand, like, how do you unmute yourself on Zoom? And how do you unmute yourself on Zoom if you don't see the little microphone flashing at you? Those are pretty important. One of the upsides, though, that I think is that we have realized that people can work from home. There are more jobs that are made available to be done remotely. And there's a great workforce of people with disabilities who can fill those positions. And I also think from a blindness standpoint that we have really begun to bring an issue to the forefront, which is the need for visual interpreting. Every graphic, every picture, everything that is posted online should either have text or an audio description that goes with it so that everyone has access to information. 2 minutes goes really fast.
Well, you did very, very well. Thank you for all of that information. And I agree, as a person with a visual impairment, with both of you. So this next question is for Tenesha and Kelly. Many hospitals and healthcare settings have not allowed visitors or someone to accompany a patient to an appointment. Has this impacted access for healthcare with people with disabilities? If so, how? You each have 2 minutes. So, Tenesha, sorry.
Sure. Yeah, I can start. I would say that the limitations and the rules that have been set around appointments, doctor's appointments, and visits to hospitals have been challenging for people because many times those appointments require accessing complex information. The healthcare professional is there and they're telling you all this information about what's coming up, and it's a lot to take in sometimes. So having that other person there as a support, and also many times just as an advocate to say, come up with other questions to be asked, to show the healthcare professional that there's support for possible recovery for maybe procedures that they're going to have in the future, showing that there's a support system around that person, that they can come through certain procedures that may be in question. But also, like I said, just having that person there as an advocate to say, here's another way to look at it, and maybe we could do this in a different way. And sometimes as a patient, when you're going into these settings, it can feel a bit overwhelming. And you also, especially if you have a disability, when you're in these settings and you're in the hospital bed and you have someone that comes in and they're taking care of your needs, many of your needs, and you're dependent upon them, it's hard to come up and speak up and say, I need this, and maybe this could be done better. And that's where it helps to have somebody else there that's looking out for just your best interest, just the patient's best interest. And I feel like that's really been affected by these rules where they don't allow this other person to come in, because there's just, like I said, there's just so much to take in, whether someone's in the hospital as an inpatient or just for the appointments, because that all it's one, piece of the puzzle for the future of this individual and how their health is going to be affected. It may seem small at the time, because they may just have one doctor's appointment, but there's notes being taken during that doctor's appointment. There's a profile that's being made for that person, and it continues on into the next doctor's appointment. So that's why I think that, you know, just having at least one other person there to say, I'm on your side, you know, even if they're just sitting next to you to support you, is really important. And I think it's also important for people who are in a nursing home setting. There's a lot of advocacy groups that have helped people in the nursing home setting in the past, and I think that the rules there have been the most strict. And I understand that they've been dealing and many times as the epicenter of this COVID pandemic. But they also need to realize that they could bring in some advocates, maybe through Zoom meetings, or try to find some kind of problem-solving ways to bring someone else in to help these people that are in an institutionalized setting that could use some support. They're unable to see their families, and you know, just having someone on their side to say, you know, this is a real person, and they have needs, and I think is really important, and that's something that could definitely be improved upon.
And I also second Tenesha on that. Having personal experience, I had a former student who back in the spring had a non-COVID medical emergency, who really needed the support of their family and to kind of have some guidance. And then also my own personal experience for my mother who lived across the state for her end stage of life planning. Is very difficult. Oftentimes visiting hours don't coincide with times doctors round. We were grateful for one doctor offering to FaceTime with our family while they were consulting with her, but that was kind of just one. I will say that Ohio Department of Developmental Disabilities did come up with guidance that I hope everyone would go look up and maybe have with them. It came out on June 29th, and that was advocating for either direct support professionals or a caregiver, patient assistant, or patient advocate to be alongside with patients. So that is a step in the right direction, but I think it's also required to get the information out there that they're allowed to have that and pull that guidance out when they're not receiving that support.
Great. Okay, and our next question is for Shannon. How has a lack of communication access impacted those in deaf and hard of hearing communities during the pandemic?
Definitely, it has been an awful experience. It's been a varied experience. When the pandemic had started, because so many unknowns of what was going on with COVID itself, we didn't know how it would spread. There really wasn't a lot of information. It was very kind of awkward. And so from hospitals to nursing homes, they were not allowing others to access. And so that was creating a barrier for those patients that were in the nursing homes and the hospitals, because before they would have interpreters be able to come in, they have some communication support. They do have technology to support that, like remote interpreting, video remote interpreting, but that's not always effective. Like if the internet's not strong enough, it would be a fuzzy view, you wouldn't be able to see or hear. So that really was kind of a mess. The lack of access, you know, you can't explain things, you can't expound on things. And so I have some notes and I wanted to look, but also when everything had started, we were getting information, you know, live information on the news, from the TV, internet, media, Facebook, live. had just been started. It wasn't very friendly for the deaf and hard of hearing community because they were depending on background noise. And so it wasn't easy to see the captions if there were any provided. Some of them were not providing interpreters. And so we had to make sure that we had that. We also wanted to make sure we had captioning. It's still a struggle. It's not perfect yet, but it's getting better. And so we definitely need to do better to provide effective access, especially to like live TV and news and things like that. Masks is another barrier. It's improving, but with masks, the deaf can't tell if the person is talking, because most hearing people don't use strong facial expressions. It's not something that hearing people tend to do, so they don't have any idea. Like deaf people would see the eyes, but they're not really sure what's being conveyed. So that is a struggle in communication. And then sometimes they would realize, oh, you are talking to me. And so there'd be some catch up there. Many deaf people themselves have some clear masks, and there were some hearing people who were providing services to the deaf community, and so that was kind of helpful for them as well. There's still not enough people, either they can't afford some of the expensive masks, the clear masks, or they don't know about the services being provided. So there's still a lack of information about that. Also with the mask, they do mitigate some sounds. So people who are hard of hearing, like senior citizens, they're missing some information. Like they can still hear you better without a mask, but with the mask on, it does create a barrier where the sound is not traveling, so they can't hear as well. Captioning, live captioning is really important because then you can see real information at that time instead of using speech to text, speech to sound text, because sometimes words sound like another word and that word would come up and it would be incorrect. Also, another struggle for the deaf community and hard of hearing community as well. Many were starting to work remotely, but they need information access. Many deaf people tend to, go in and, say that I need paper and things like that. There were so many things there. And so it was kind of changing how we were getting information. Looking over my notes. So I think that's pretty much it. I think that covers it.
Thank you, Shannon. This next question is for Sara and Shannon. It is important that the virtual learning platforms are not only accessible for the students, but for the instructors, parents, and guardians as well. What are some of the issues that you have seen with lack of access to these learning platforms?
Ooh,
Sara?
That is a fantastic question, and I could really wax poetic for more than 2 minutes about the struggles, but I'll try to keep it pretty brief. So this access to different learning platforms, it really truly affects people. I know I speak a lot about people who are blind or have visual impairments, but it really affects so many different people who have different disabilities. And I will speak very briefly as somebody who provides academic and residential accommodations. A lot of my students who have diagnosis of anxiety disorders, when we went online last spring, I had some students who just, oh my gosh, were in tears, and they were emailing me every day because that total all of a sudden cutoff of information and having to figure out how to access everything online, even though for them it wasn't necessarily that the platform wasn't accessible. It was very anxiety inducing for a lot of people. And I spent much of my time emailing students and telling them, how great they were and, just kind of working out plans with instructors to help people. It was just a very stressful time. For those of us with visual impairments, I will speak as a professional and as a parent and as a student. A lot of the information that is put up on different platforms, say like in the K-12 system, we'll use that as an example first, it's not accessible. So even if some of the platforms the person can access with their screen readers, a lot of the information that's on the platform, if it's not put in a format that screen readers can access, it is the most overwhelming and stressful thing. And if you're a student who has a disability and you're trying to access information, it doesn't always work. And if you're a parent who has, let's just say visual impairment to start off with, but this could count for so many different things. If you're a parent with a visual impairment and you're trying to help a student, your child, and you can't read their stuff and there's just pictures and slides and things that your screen reader won't read, it's so overwhelming for parents. And I will tell you that even in the college setting, we come across all the time students who try to access information that their instructors are putting up in their learning platform, Canvas, Blackboard, what have you, and it's not accessible. So like maybe someone will be talking about putting a paper in an APA format, and the students will ask for examples of APA writing, and the instructor will put up pictures, like screenshots. Well, that doesn't help if you can't see because the screen reader doesn't know how to interpret that. So it's just really quite a challenge and quite a struggle right now for a lot of people. And I know that I do focus a lot on blindness because that's kind of what I do, but for all of my students with learning disabilities, students with cognitive disabilities, students who have a mental health diagnosis, it's very overwhelming. Students who are deaf or hard of hearing, very, very difficult if things aren't captioned correctly, videos. So I would say really accessing all these platforms right now, it's great that we live in an age where we have such things, but for the disability community, and please, people can correct me if I'm being a little dramatic, but I don't think I am. This time, while we are grateful that we can stay home and safe like everybody else, it's hard for us to sometimes navigate these platforms, help our children, help our students, and function.
Okay, Shannon?
Oh, yes. Going to learning online was definitely difficult. It was a challenge for students with hearing loss. Some of them depend on hearing if they're hard of hearing, some depend on signing, some depend on captions. For the teachers who work with those students, for the parents, the appropriate technological equipment. Sometimes laptops are small, you can't make it bigger. It wouldn't be life size. It was very frustrating. I know I've worked with a few teachers of the deaf, and they have mentioned a lot of struggles, like how to work with proper audiological equipment, headphones. I've also been working with speech therapists and captioning. You know, sometimes it doesn't work. Technology fails, internet is sketchy. There's just a lot of struggles, and many students also really themselves don't really understand how things work, and they don't know what's happening in the world. And so some of those students really just don't know what's going on and what's happening. So they were, you know, sent home for a long spring break, basically, because sometimes there's no communication access at home, unfortunately. You know, sometimes the parents cannot communicate with their children. And so right now, technology is better. There's a few, I've been working with some schools with the equipment issues. We've been talking about the masks, what would be most effective. And so we've got a list for that. So this definitely is a good time to learn how to improve technology to provide for the future. You know, for this, you know, this pandemic really did hit us, and it will affect us for the future.
Okay. Sorry, give me 1 second. Okay, so for Tenesha and Sara, how has socially distancing impacted? How has it?
Accessibility.
How is, yes, accessibility. I'm sorry. Evidently, I skipped that question. So that was for Sara and Tenesha.
I can start with that. I think that it's another instance where some rules have been put into place rather quickly without consideration to those of us with disabilities. And in these situations, it's important for nonprofits and advocacy groups to try to improve these rules, but it's also important to empower people with disabilities who are out in the world to be able to speak up in a case-by-case instance to say these rules for social distancing, like the stickers that are on the floor, not having for people who are visually impaired, they don't have anything for them to be able to see where those stickers are, or just in general, not taking into account people with disabilities when they put these rules together. I think that the person needs to be empowered to feel like they can speak up and say, hey, this could be done better. And say that sometimes that can be very difficult. But one thing that I heard from someone that really helped me was they said that when you're in an instance like that, you're not just fighting for yourself, but you're fighting for the next person that comes after you in that situation, in that restaurant, in that setting where these challenges come up. So, and that person may not be able to speak up for themselves. So when you're able to do that and you're in these situations where there's challenges that can be, sometimes it's just simple little changes that can help. I think that it's really important for the individual to feel like they have the ability to make those changes on a case-by-case basis. Also, I think that in regards to social distancing, I think that this has created some challenges to people who have aides that come to their home to help them with their daily life. And so there's communication issues where the aides have certain expectations about how the person that they're caring for needs to go about their daily life. And in some instances I know of where the aide is kind of telling the person that they're caring for what they can and cannot do going out into the world, because it's in an effort to try to keep them safe, but it's also hard because the person that they're caring for feels like that they don't know exactly what the rules are. They don't know exactly how they can go about their life, and they're afraid that they're going to lose their aid over something that they may do, and that's why it's hard, because there's nothing set in stone, and it's on a case-by-case basis again, where I think communication is really effective for people to feel like they can talk through some of these issues and come up with a solution that works best for them. But there's definitely a lot of challenges there. It's definitely something that can be addressed, and it's something that can move forward in a positive way. It's just, it's important to be empowered.
Thank you. Sara, how has social distancing been for you?
Oh, well, it's been an adventure. I'm somebody who has used a guide dog for mobility since I was 16. And our guide dogs are very highly trained creatures, guide dogs and service dogs, let's just say. However, guide dogs are not trained to social distance. That's not something that you can teach a dog, okay, keep a buffer of 6 feet, 3 feet, whatever, between you and the person. Their job is to make sure that they avoid obstacles, people, but avoiding could be 6 inches away. They don't know. A lot of people with visual impairments need to sometimes go sighted guide or human guide if they're walking somewhere that they're not familiar, which means that they take someone's elbow and walk with them. A lot of times, like in a grocery store, people, if they are trying to follow someone who's assisting them to get their groceries, they would go sighted guide. And both people who are blind or visually impaired and also the people who are supposed to be assisting them, like out and about, the blind people, we don't necessarily want to touch you because we don't know where you've been, and you don't necessarily want to be touched because you don't know where we've been, and it's not social distanced at all. It's really quite a challenge. And, you know, as I said, I work at a university, and so I actually put out an email at the beginning of the year because we are a very nurturing, supportive community here at Lourdes, and people come up and talk to me all the time. And so I sent out a very kind email and said, you know, Vivi, my dog, she can't socially distance. So please, if you see me, try to keep a little bubble between you and me because I can't see you. And I love you, but I don't want to get that close to you. I think also when it comes to people who are blind or visually impaired, having to like use their hands a little more often. And I hate saying like my hands are kind of like my eyes because it sounds really creepy and gropey, and I don't mean to come across that way, but there are times where we do have to touch things, and we may have to touch a door 3 times to find the handle. And so we're coming in contact, you know, with more surfaces, and that's a little gross too. But yes, definitely during the pandemic, I felt extremely isolated. I'm very blessed to have a very good family structure. And so like if I went to the grocery store, I'd go with my husband, and I would leave my dog at home because I didn't want people coming up to me, and we would go sighted guide. And it was just very stressful and isolating, but there really are some barriers right now to people who need assistance. And then think about the people who use wheelchairs who may have to take paratransit. And so the driver has to strap their wheelchairs in. And so you're like leaning over the person to do that. So like you're like in very close contact with people. And that can just be, I think, a little difficult on many levels. People who may need someone to take their hands and show them something, again, very difficult. You know, there are times where as much as we want to social distance and other people may want to social distance from us, for the nature of what we need, it's sometimes a little impossible. So it's just kind of been a challenge, and I just really respect the people who have been willing to assist from afar. Very, very helpful.
Thank you, Sara. I cannot agree more that as also a person that is blind, we do have to touch a lot more surfaces. And like you said, touch a door 3 times to figure out where the handle is. And it's been tough with the social distancing, 6 feet and all of that. So thank you. The next question is for Sara, Dani, and Kelly. Many people with disabilities rely on public transportation to navigate independently. Can you discuss how access to public transportation has changed as a result of the pandemic?
Would you like me
Sara?
to go first? Okay. So I personally right now myself am not utilizing any paratransit or public transit services. I'm extremely lucky to have the support that I do. However, not everybody is as blessed as I am to be able to have that support. It's really been a challenge for people. Either they get cut off, maybe the hours are changed, you know, or they have to ride in vehicles and they don't know, like, is it sanitized, or are we socially distanced enough from our drivers? A challenge that I have found for people with disabilities also who utilize para and public transportation is, let's say you have to take your dog to the vet, which I did 2 days ago. It's curbside at a lot of places. So that you stay in your car, they come out, they get your animal, they take them in, they do what they need to do, and they bring them out to you, which is great in theory. It's trying to keep people safe. But if you don't have a car and you have to get a ride to the vet, either you're paying a lot of extra for like an Uber to wait on you, or, you know, it's just very difficult. So I feel like in general, just relying on transportation that is not like a personal vehicle of your family is very challenging for a lot of people. And I have a lot of friends in the disability community who are very hesitant. And it's not because of the companies who own, you know, public transportation and paratransit. It's not that they're not doing a good job sanitizing, but you know, we want to be socially distanced as well. And a lot of us may have compromised immune systems. It just may not be safe to be accessing public and paratransit right now. It's a very stressful situation. And for me, I will say this, I absolutely loved my quiet commute to work. My drivers on TARPs, the paratransit here, they know me very well. They know I'll chat with them for like 5 minutes, and then I drink my coffee and I read my book. And this is like very important to me. It's my quiet commute time to get my brain ready for the workday. Also on the way home to kind of transition from that workday really busy to mom. So I really value that time. And now I have family members who drive me and they want to talk to me, and it's like, oh my God, and it's their cars. And so like I talk to them too, but I feel like I'm really missing that peaceful commute time coming to and from work. With that's just a little, like, not really a true issue, but I truly miss that.
Great. Okay, Dani?
Yeah, I can piggyback on what Sara said. Just even thinking about like the drive-through options. If you're a person and you're relying on a ride share, the ride share services have been reduced. And then if you used to be able to go in and have a one-on-one conversation, say with a pharmacist or with somebody, and now you're using a drive-through service because the in-person services are so reduced, now you've got a stranger or a driver or even a family member who knows your personal business, and you might not have preferred that. You know, it's a little bit of a privacy issue. And that's pretty frustrating. Some of it goes back to technology. Where are we communicating timetables that have changed? Where are we communicating reductions in services? And we know those things are happening. How do we keep up with all that information if it's not so readily accessible? We have found that there's just a lot of times where the services that used to be in place are just reduced or eliminated because of concerns of COVID. It kind of piggybacks on what Tenesha said. COVID is very, very real, and we get that, but we're laying the groundwork for how people are going to approach individuals with disabilities for all future medical crises and emergencies. So we're kind of trailblazing right now, and we need to drive the point home that advocacy and empowerment is more important than COVID. And we just need to keep finding ways to help people know that we're here to ask for help in solving these problems like transportation, so that we can get creative together. We can bring back that sense of community, and we can hold maybe some community leaders responsible for making sure that transportation stays reliable, it stays accessible, it remains efficient for people who have important places that they have to go.
Good answer.
I wasn't watching the clock.
Oh, okay. Kelly?
Yeah, I just second what they both said, and I would just advocate that any organization or a medical professional office that is having curbside service or have individuals wait in a car, kind of run through a scenario if they were using public or paratransit, and what does that mean for those individuals accessing it. And I think they would just have a little bit of more awareness if they had to do a dry run through and experience that themselves, and could better facilitate how they support their clients or customers.
Okay, excellent. Okay, everyone, this question is for everyone, and we'll use the same lineup as we did for the intros. So, do you think access issues that have been brought to light as a result of COVID will improve things down the road? If so, how? So, Sara, if you could go first. Are you there? Can you guys hear me?
Sara was muted for a second. Sara's muted again. She went from mute to unmute.
Okay, wait. Maybe why Sarah's trying to figure that out. Why don't we go with Dani?
So just in thinking about even times like this where we as a group have come together in planning for today and in thinking about what kinds of information we wanted to convey, I think we're doing some of the groundwork. I think we're letting people know that we're here, that we care, and that we're going to stand with people who need to problem solve through some of the new normal, which is a term I hate, but how are we going to help people to understand that you don't have to have all the answers, yourself. You just need to know who to ask, and how can we brainstorm through what your situation is, and how can we convey that information so that everybody knows where to ask, what to do, and like that dry run idea. If we could just get more people thinking like that, if we could set the platform for, not that everybody's doing things wrong, but look at how much better we can be if we use all the information that we are here to provide and support. I guess that's the message I would like people to take away is, don't feel like you have to solve all the problems yourself, and to reach out to the community that's here, because there's so much information and passion to make, our community, and then to make our community a model for other communities to do it right.
That's excellent. Shannon, your thoughts on that?
Oh, yes. I remember when the pandemic had just started, the first thing I said was, oh, technology and communication access will definitely improve. And the reason for that is because deaf people have been using this technology for communication access. We've been using video phones and Zoom for apps for meetings. We've been using these kind of systems for a while. We've been using video remote interpreting, VRI. We've been using these different things, but we have been struggling with different issues in it, with the internet connections, with the quality of the captioning, actually getting an interpreter, and the kind of interpreter that we need to actually provide the information appropriately for the person's needs. For example, it's becoming more popular to use what's called a deaf interpreter, because that is a better way to provide the information in their native language. So really, there's a lot of things, but I'm definitely seeing technology access improve because of you guys, because of hearing people complaining, and they're noticing that, oh, the video's blurry, the captions are wrong, things like that. It's because of you, and the number of you are bigger than the number of deaf. So, I mean, we are approximately 10% of the population. Anyone could, with a hearing loss, that could be big, but you all, 90% of you who have hearing, have been able to influence this and help advocate more for us as well, and helped improve our access, our effective access.
Well said, Shannon. Thank you. Okay, Tenesha.
Yeah, that's a good question. I think that one thing that this has brought about has been that problem solving is very important, and going about it with a good attitude, that change is possible and that we can make things better is very important, that we can evolve. And I think that's something that people with disabilities do very well, is problem solve and evolve, because we want our lives to be as enriched as possible. And these things that come upon us as challenges we're used to on a daily basis. We come across challenges all the time, and we know that if we put our minds to it, that we can overcome. And it's the same thing with this situation. I think that one of the other things that we can really value is, and we've come to value even more, is just being with others and coming together for problem solving through these meetings, and coming up with ways to address challenges. And so moving forward, if we continue that to try to fight for the right answers to these challenges as they come up, I think is just, it's wonderful. I think it's positive. It's a move in the right direction. We can just keep on going with that momentum and take it forward into the future as far as we don't know exactly what it's going to look like, but we know what our attitude can be towards it. And that is that we can affect change, and that we can affect change in a positive way for others and for ourselves.
Great. Kelly?
Right. I think it's individualized, whether it's improving access or not. Definitely a drastic difference from those living in a congregate setting versus those living in their own community homes. I personally have learned a lot as a professional just from these different webinars that are being held and learning about diverse issues that are across the board. But I can see where technology is really beginning to play an important role, and the demands for it are helping to improve each person's access.
Great. Sara, is your mic working?
I think so. Can you hear me now?
Yes.
Oh, hooray. Okay. So I feel like this is such a great question. And I feel like, yes, we've had so many challenges during COVID, but in my opinion, these challenges have always been here. I feel like COVID has just really pushed them to the forefront, because before COVID, there were more support systems in place, or most of the time. I'm not saying for every single person they have like the most fabulous support system, but there were supports put in place so that people could access their community. And when COVID happened and people had to rely pretty strictly on technology, and people kind of lost that interpersonal interaction, I feel that it really brought a lot of these concerns for people with many different disabilities to the forefront. So I feel that if people continue to improve, even if COVID is the motivator, after COVID is over, I mean, these concerns are not going to go away. I mean, people are still going to have curbside pickup. People are still going to want to do online shopping. People still have to go to the grocery store. That stuff's never going to change. People have to access, learning platforms. So, I mean, I hate to try to say that COVID can make anything into a positive, because it's been a very stressful year for a lot of people and a very heartbreaking year. But my hope is that people will continue these discussions even after COVID is over, and we can go back to what we consider normal. I mean, that's just my hope, because I feel like I said, a lot of these concerns that we're talking about today, they've always been here. They're just magnified.
That's great. I'd like to weigh in just a moment on this one. There was another question that I did not weigh in on, but I feel with lack of transportation, sometimes that those of us that don't drive have. I've been able to attend some meetings that I was unable to attend for quite a while just because of transportation. So the Zoom meetings and the webinars I have found to be very helpful. And I've been able to attend some of the meetings that I wasn't able to before. So I think that going forward, once COVID is over, maybe we'd be able to still join onto a meeting via Zoom, even if people are gathered together. So I've enjoyed that personally. So, okay, that's all of our questions. Thanks everybody for all of your wonderful answers and your participation. And I will turn it back over to Katie Shelley.
Yes, I just want to say thank you again to all of our panelists today. You all did wonderful, and thank you so much for answering all of our questions. Really appreciate you being here. And just before everyone leaves, I just wanted to remind everyone to check out our ADA seminar website, and I will put that link in the chat. So give me a minute, because I was having computer issues, but we are back and we are live. So we just want to thank everyone. And if you indicated that you are attending this webinar for CLE credit, we want to make sure that you get the credit you deserve. So please be sure that you fill out the survey that pops up as you exit this webinar. You have to click yes in order to get your CLE code. Also make sure that you provide us with your bar number so that we can submit the proper documentation to the Ohio Supreme Court on our end. And we just want to say thank you again, and we hope to see you all again on Tuesday. Thank you, and have a great day, everybody.